So once again, more information for you. Now, once again, ladies and gentlemen, in Singapore, CVD accounted for 31.7% of all death in 2020. Now, this means that almost 1 out of 3 deaths in Singapore is due to heart diseases and stroke. So if any questions later on, please send them in the chat after, all right, that after our survivor, Amelia has spoken. So please stay with us. Okay, so I hope you guys are ready. All right. So today, ladies and gentlemen, joining us in our session here, we have it's an interventional cardiologist, Dr. Haan, who will also be sharing more about the common and uncommon symptoms of a heart attack. And also we have Ms Amilia, a heart attack survivor and client of the Singapore Heart Foundation Heart Wellness Center, who will also tell us more about her experience of heart attack and how she is getting back on track. Okay, so if you're ready, ladies and gentlemen, let's begin our talk for today. I'd like to now hand over the session to Dr. Lim. Dr. Lim, welcome.
Hello, thank you so much for the kind introduction. Thank you to Heart Foundation, Singapore Heart Foundation for arranging for this talk so we can share some experiences with you. I can already see that there are many questions in the chat box. So I'm going to start my slide presentation. Okay, all right. So thank you, Samson, for your kind introduction. I am Dr. Lim Ing Han from Mount Elizabeth Hospital. I have been seeing and treating heart attack patients since the early 2000s, and I just want to send a message today that the earlier you start to check for heart disease, the better it is, and it is possible to start a heart attack before you get it. There are many previous reports of heart attacks affecting both the young and the elderly. But the trend I see nowadays, because I still go on heart attack calls, when the hospital gets heart attack patients coming in by ambulance, cardiologists get called to open up the arteries for them. And the trend I'm seeing nowadays is that heart attack patients tend to get younger and younger. In fact, people in their late 30s can also get heart attack. As you can see from all these newspaper clips, even athletes are not immune to heart attack. So the question is, how do you tell what are your risk of getting a heart attack? And I'm here to share some of the knowledge that we have. A lot of times, heart attack occurs without warning. There may not be prior chest pain. There may not be any previous history of shortness of breath or any discomfort or palpitations. But sometimes the first attack is a fatal one. So the message is to check early. Heart attack can occur and creep silently. So I know a lot of people in the audience go for health screening. Please remember to do yearly health screening, especially if you're more than 40 years old. You should at least do a blood test, to go to your GP's office to make sure your blood pressure is okay, to make sure that you do not have risk factors of diabetes and hypercholesterolemia. As you can see here, this is a newspaper clipping of Bill Clinton. Bill Clinton is by no means somebody who does not do health screening, but having said that, he did suffer from heart disease. Famously, he had a bypass operation and at the age of 56. And even after that, despite the best medical therapy, he still required 2 stenting procedures about at the age of 63. But post-stenting, he's still able to lead a normal life. He's still able to be very active in his political career. So the message to everyone is, if you survive the first heart attack, don't give up. We can actually, with the latest medical therapy, we can actually allow you to lead normal lives. And unless the heart is badly, severely damaged from the first attack, usually there's no problem with your usual lifestyle. We can also see that in the region, these are the famous politicians in the region. They are also not immune to having heart disease. Heart disease is actually the first and the topmost most common disease and the number one killer in the whole world right now after cancer. So how does it occur? There is usually when the artery, as you can see on the left, is artery supplies oxygen to the heart muscle. So as you can see on the left, in the first decade of life, the artery is normal. But by the second decade of life, in the late teenage years, fatty deposits start to deposit onto the artery. By the third decade and the fourth decade of life, there will be a significant number of individuals here in the audience that have already developed artery blockages. You can see that as you grow older, by the time you're 70 years old, even if you do not have any risk factors of high blood pressure, diabetes, or cholesterol, there is at least a 30% chance that there will be some blocked arteries within the body. So this is a process called atherosclerosis. I'd like to highlight why it is important for the heart. In the heart, why atherosclerosis is important for the heart. So the heart is here. It is supplied by 3 arteries. You have a healthy artery on the top and a blocked artery at the bottom. As you can see, each part of the heart muscle is only supplied by 1 artery. If there is a blockage by within any of these arteries, then there will be lack of oxygen supply to the heart muscle. Sometimes you can feel something. Sometimes you can feel chest pain. Sometimes you cannot feel it. There are no symptoms. We call it asymptomatic. But whatever it is, once the artery is blocked, the oxygen supply to the heart muscle will be impaired, and there will be potential problems. One of the most important potential problems is the development of a heart attack. Because each part of the heart muscle is supplied only by 1 artery, if a blood clot forms on top of the fatty deposit, that part of the heart muscle dies from lack of oxygen, and that is called a heart attack. We usually call this process plaque rupture. The yellow part is a fatty plaque. Sometimes the fatty plaque, it remains stable over many, many years, and in fact become calcified. It becomes a calcified and hardened plaque. But occasionally, without warning, the plaque can rupture, and the red blood cells, instead of flowing through, get stuck inside. And this causes a complete blockage of the artery, and that is a heart attack. So one of the questions I noticed before I started the talk is, if you have calcified arteries, will it still result in a heart attack? Yes. When a plaque is first formed, it is soft and very friable, so it is very easy to get heart attacks. However, after many, many, many years in the body, the oxidation occurs. The plaque becomes hardened, but that is by no means to say that heart attack will never occur, because there will always be new plaques next to it that can be still susceptible to rupturing, and then still susceptible to a thrombus or a blood clot forming over and blocking up the artery. The most lethal thing that can happen is the heart stopping. So when a heart attack first occurs, the shock of the blocked artery sometimes causes arrhythmias to occur. This is a normal heart rhythm that degenerates into ventricular fibrillation. During ventricular fibrillation, in short, VF, the heart, instead of pumping regularly, will stop pumping and then just fibrillate away. So the heart cannot be effectively pumping blood to the brain, which is super important, and it cannot pump blood to the rest of the body. So VF, or this irregular heart rhythm, is usually fatal unless a bystander performs CPR when someone collapsed, and then uses an automated defibrillator to shock the heart back to normal rhythm. Okay, So occasionally, a heart attack becomes fatal because of arrhythmias. So if somebody collapses on the pavement and clutches his chest, or may not clutch his chest, collapses on a pavement, those who have done or who have undergone training for CPR must immediately go over, check the pulse, and feel if there's any pulse. If there's no pulse, you must immediately institute CPR and call for help, because that's the only way in which you can help the heart, help pump blood through to the brain to save the individual. So how do we prevent heart attack? The prevention starts with early diagnosis. Early and accurate diagnosis is super important. There are multiple, usually we can predict which patients are at higher risk by looking at a number of risk factors. First, those risk factors that cannot be controlled are age. So the older individual has higher risk. Sex, male tend to have higher risk compared to female in the premenopausal age group. However, after menopause, the females are no longer protected by the female hormones, and the risk of heart attack increases drastically after menopause. And the presence of family history is something that we ought to be aware of. So let's say if you have first-degree relatives, like parents or siblings having heart attack at a younger age, then it is also a reason to look for a doctor to check whether you also have a risk of getting a heart attack. Earlier on, I mentioned making a trip to the GP's office, to your nearby family physician for health checkup. The reason is we need to look for the three most common risk factors. Number one is high blood pressure. Number two is hypercholesterolemia. And number three is diabetes. These are the risks that can be treated early. And if treated early over many years, it will prevent problems decades down the road. So look for early high blood pressure, hypercholesterolemia, and development of diabetes. Of course, there are other risk factors that are related to that are not related to uncontrolled level factors like age and sex and family history, but are related to your own habits. Smoking is a risk factor, and obesity is another risk factor. But it doesn't mean that if there are no risk factors or no obvious risk factors, one is not at a risk of getting a heart attack. That can still happen. So if there is a family history of very young relatives with heart attack, then generally speaking, when you go to a doctor's office, we would check for the more obscure risk factors, like checking the blood for Lp(a), checking the blood for homocysteine levels. So heart attacks, the other message I wanted to say is heart attack does not have to come with symptoms. There are times when a heart attack is silent. So that's one. The other thing is heart attack doesn't have to affect very severely blocked arteries. Occasionally, we have treated heart attacks, and the blockage within the arteries is quite minor. So this is the key question: what are the signs of heart attack? What are the things that you feel to make you suspect that maybe having a heart attack? I'll start with describing typical angina. Typical angina is the term for chest pain coming from the heart. So typical angina occurs on the left part of the chest wall, and sometimes it can be a chest pressure. It can be a tight. It can be people can feel a stone pressing on the chest. The chest pain may be localized on the left side of the chest, or it may radiate down the left arm and also to the jaw. So patients have described chest pain in the back as well, and also pain on the right of the chest. But usually, typical angina occurs repeatedly, the same nature, and is usually occurs on exertion, which means that the patient may describe walking a distance or carrying some heavy things from shopping, and then feeling this tightness in the chest, and it happens repeatedly. So if there is pain that that occurs when you're resting, when you're watching TV, a lot of times it is muscular pain or bone pain. And one of the telltale signs of muscular pain or and not heart pain is that if you press on the chest wall at the exact spot of the pain, it's painful, then it's most likely pain from the ribs. There are some other descriptions of chest pain that is typical for the cardiovascular system. Patients have described tearing pain as if some sharp tearing pain is occurring in the chest. That is important. If you have that together with shortness of breath, with sweating and all that, then you have to immediately go call the ambulance and get to the emergency department, because that type of pain may be related to a tearing of the wall of the aorta, which is the biggest artery in the body. So there are many, many different types of pain that has been described, but typical angina, as I said, occurs repeatedly and usually occurs with exertion. However, some people wait for many, many, many years before they seek treatment. And if the blockages are so severe, the pain can occur even when they're not doing anything. That is what we call rest angina. Rest angina is very suspicious of very tight blockages. And typically, I have heard of descriptions where people get chest pain when they eat. The reason is when you're swallowing food, the stomach needs to digest the food. And so when the blood goes to the stomach, the heart is deprived of oxygen and the patient complains of chest pain. This is what I've said earlier. The typical distribution of pain is on the left side of the chest, down the left arm. It can go up to the jaw. It can also go to the back. I want to highlight the pain in the epigastrium or pain near to the stomach, near to the lower part of your chest. It is very notoriously known that patients have thought that they had gastric issues, but actually the pain is due to the heart. Okay, so if you have pain in any of these areas, please seek medical advice. The pain is usually associated with usually pain from the heart is associated with some other symptoms. Typically, patients would say that they have difficulty breathing, they feel short of breath, and some of them will break out in cold sweat. Okay, that is very typical, or they may feel nauseated. People feel nauseated because the heart is next to the stomach, so it affects the stomach. And if there is dizziness, that's even worse because it can be a result of arrhythmias. Heart attack or heart artery blockages does not occur alone on its own. A lot of times there will be other blockages in other parts of the body. The most important parts of the body other than the heart would be the brain, and it can present as a stroke or either a severe stroke or a mild stroke, of course, and it can also affect artery blockages can also affect the legs, causing a blackened gangrenous toe or non-healing ulcers. So when patients come to my clinic, I would usually check for all the other important arterial systems of the body. It doesn't just have to be the heart. I'll be checking the brain and the circulation to the leg as well. Sometimes the arteries to the kidneys may be blocked, and those blockages may cause uncontrolled high blood pressure. So we even have to open up the arteries of the kidney to relieve high blood pressure. Nowadays, there is a marked increase in an epidemic of heart disease, and this is due to the current lifestyle. We can blame it on the epidemic of metabolic syndrome. Metabolic syndrome, I like to talk a little bit more about it because these are the ways in which you can predict who is at risk of getting heart disease. As I said earlier, there are all those risks of high blood pressure, diabetes, and cholesterol. But before someone develops outright high blood pressure, diabetes, or severe high cholesterol issues, there's this thing called metabolic syndrome, which is purely a lifestyle disease of eating too much of carbohydrates, having too rich diet in fat, or too much alcohol. So that is the disease of abdominal obesity around the middle, and high sugar levels, but not reaching the diabetic range, high cholesterol levels, and high blood pressure. So this is called metabolic syndrome. We know it is a problem because even now, with boys going to army, there'll be a significant number of boys who are overweight. They have metabolic syndrome. Some of them have come for blood tests. They come along with their parents to my clinic. I've done blood tests for them. They have fatty liver and liver inflammation. So metabolic syndrome is an epidemic right now. And if you know about it, if you know that you can control it by controlling your diet, your risk can go down. What are the other ways of knowing that one is at risk? Is to look for evidence of high cholesterol. So if you look at the eyelids of these individuals, you can see fatty deposits. We call it xanthelasma. Xanthelasma, of course, is a cosmetic problem. You can remove it, but it will grow back. Patients with xanthelasma have very high cholesterol levels. Okay, so how do we diagnose someone has heart problems? First is, of course, the usual history of looking at all the risk factors. And secondly, we do an ECG. Thirdly, we'll be doing an echocardiogram. So what is an echocardiogram? Echocardiogram is an ultrasound of the heart. You can see on the left-hand panel, this is a normal contraction of the left ventricle of the heart. And if you look at the right-hand panel, this heart does not contract fully. You can see that it does not contract fully. So this is considered a weak heart, and this is a normal heart. On the four-chamber view, you can see that this heart is contracting normally, whereas this heart is not really contracting properly. So when a heart is weak, it can sometimes also be swollen and dilated. And this problem is diagnosed on an ultrasound, which is also called a 2D echocardiogram. When you go to a doctor's clinic to check the heart, there are two methods. There are generally two methods that we can use to diagnose artery blockages. The first method you would have heard before would be a treadmill test. And then there is the nuclear scan. And thirdly, there is the CT scan. I just want to talk a little bit about the treadmill test. There have been instances where I offer treadmill tests to patients and they say, oh, but I do treadmill at home. But I can assure you it's not the same thing. The treadmill test in cardiologist clinic involves running on a treadmill. Every 3 minutes, the treadmill will not just increase in speed, but also increase in slope. So when the treadmill increases in speed and slope, the heart rate increases. And generally, we can tell from the ECG monitoring whether there are blockages. Treadmill is very good because if you pass a treadmill test, then the chances of getting a heart attack within 1 year is less than 1%. However, it is not foolproof because nothing on earth is foolproof. If you do not pass a treadmill test though, then comes the next step of finding out what actually is happening, because the treadmill test is only 70% accurate. It is only 70% accurate because the treadmill test does not pick up minor blockages, it picks up severe blockages. So once a person fails a treadmill test, we will then have to offer other tests that are more accurate than the 70% accuracy that the treadmill test gives. And that would be, generally speaking, in a cardiologist clinic, we will send the patient for a cardiac CT. A cardiac CT, as you can see on the right hand side, involves lying on the CT machine with the head out there, and then we'll inject contrast into the vein. And once the contrast reaches the heart, the CT scan machine will take 640 slides of the heart, and we will reconstruct it and look at artery blockages. So for example, this artery this is the heart, it pumps blood out through the artery. So over here, you can see a minor blockage of the artery, which is seen on different views. So this is how accurate a CT scan is, meaning it is 99% accurate compared to a 70% accurate treadmill. A CT scan is 99% accurate in diagnosing even very small blockages, and we can detect how serious, as in how many percent the blockage is, to determine whether you need to go for stenting procedures. Other than doing a CT scan, as I said earlier, blocked arteries doesn't just involve the heart. Sometimes it can involve your very important part of the body, which is your brain. So I would also offer a carotid ultrasound scan. If you put your finger next to your throat, over here, you will be able to feel a pulse. There is an artery here that goes to the right side of the brain, and on the left, there is another artery that goes to the left side of the brain, and the name for the artery is the carotid artery. So we can do an ultrasound of the carotid artery to look at the wall in detail. It's amazing that we can just by doing an ultrasound of the neck, detect blockage in the arteries. This is a color flow Doppler telling you that this is an artery with blood flow, and this is a blockage. I can tell you that right now, for patients as young as 35 years old, I'm already seeing blockages of this extent in the arteries. So the arteries are no longer beautiful. Once it has blockages, it generally means that we have to immediately start treatment. Usually the treatment is just cholesterol medicine, because you don't really want to wait until there's a stroke or until there's a heart attack. I jumped a little bit earlier. I mentioned there was a third test to look for heart artery blockages, and it's a nuclear scan. So I shall simply say that a nuclear scan allows us to tell which part of the heart has enough oxygen supply and which part doesn't. So these are paired scans of the cross section of the heart. The top and the bottom, and the top and the bottom looks at the heart at rest and the heart at stress. So if there is a difference in the picture, like over here, the orange color is gone, it just means that there is no oxygen flow to this part of the heart. So this person has a blocked artery that supplies this part of the heart. And if, let's say, the black part affects both the rest and the stress, it means that the heart artery is already damaged. Okay, well, it is very important to understand what then goes on after a person gets a blockage, a severe blockage, or if a heart attack occurs. So we generally have to do a procedure called an angiogram. Angio refers to artery, gram refers to taking a picture. It involves, another term for it is called cardiac catheterization. Cardiac refers to the heart. Catheterization refers to this catheter that goes to the heart. So traditionally, or 10 years ago, we used to put catheter through the femoral artery here. But now, most of my cases, I'll go through the radial artery, where you put a catheter into the heart and to look for the opening of the heart arteries, and then inject contrast into the arteries to look for blockages. So this is how it looks like. This is when the contrast goes in and gets injected. We can see the arteries and see whether there's any problem with the arteries. That's on the left side, and this is on the right side. This patient has normal arteries. So this is a normal artery. This is a blocked artery. What happens, as I explained earlier, when the artery gets blocked is the oxygen to the heart muscle gets compromised and the heart attack occurs. So you get chest pain and arrhythmias. And if it's not treated early, the heart will be irreversibly damaged and the heart will be forever weak. However, the good news is where we have come out with a really good system in if the ambulance is called, the ambulance activates the cardiologist straight away, the interventional cardiologist straight away. So we are on the way down to the hospital while you're on the way down to the emergency. So within 90 minutes of getting a heart attack, generally, if you reach the hospital, your artery will be opened within 90 minutes. So that is the good news. Why do we need to do that? Why are we so much in a hurry? We're so much in a hurry is the reason is beyond 90 minutes, the chance of dying is very high. The second reason is if the artery is not opened by 6 hours, beyond 6 hours, the muscle cannot be salvaged anymore. So forever the heart will be weak and forever there will be problems and the patient will be breathless and have leg swelling and all that. So we have to open up the artery straight away. So the message is, if there is chest pain, if there is any suggestion that it may be getting a heart attack, if the pain doesn't go away after half an hour, please call the ambulance and come to hospital straight away. Do not delay. We have patients that said that, oh, I have chest pain at 12 midnight and then only come in at 6 a.m. or even worse, come in at lunchtime the next day because they just can't believe they have a heart problem. So if the chest pain does not remit after half an hour and it's very severe, there's palpitations, there's sweating, cold sweats, breathlessness, call the ambulance straight away. It is better to be sure than to have a delay and risk damaging the heart irreversibly. This patient had a completely blocked right coronary artery, which by just putting a balloon and putting a short stent, the artery is recanalized and blood and oxygen can flow down and supply the heart muscles. So this is how a heart attack artery looks like. So what we do, what we do is what we call balloon angioplasty. In simple layman terms, we call it ballooning the artery. So the catheter is already sitting in the arm. We can put anything we want through the catheter. Usually we put a wire first and then put a balloon to the spot where there's a blockage and open up the balloon to open up the artery. This is called angioplasty. Angio refers to the artery and plasty refers to like plastic surgery to the heart. Okay, then you put a stent. So that's angioplasty and stenting. And I'd like to show you a small video. Okay, let's hope this moves. It does. Okay, so I'm gonna start. Okay, that was the ballooning and that's the stent. Okay. Let's see. Oh, let's see whether I can start it again. Okay, so when there's a blockage, we put a wire in and we put a balloon. When the balloon inflates, the blockage will be gone. But the moment you pull out the balloon, the wall will collapse. So I have to put a stent. So angioplasty is always followed by stenting. We will usually at this point never do angioplasty without stenting. Okay, so how do we get into the heart? This part, I think for people who are very curious, it is important. Anywhere that you can feel a pulse, you can reach the heart. Okay, so traditionally we're going through the femoral artery, but nowadays we're going through the radial artery. There are two arteries in the arm going to the heart. We usually go in through the radial artery. But because there are two arteries, your hand will be fine. Your hand won't turn black and nothing will happen to the hand. Okay, it is just a puncture. It is not an operation. And therefore, after the procedure, you get a tight bandage and for 2 hours. And after that, you just walk home with a handy plaster the next day. However, if it is through the leg, usually it's a more difficult procedure. This is me doing a heart procedure. As you can see, it is all done under sterile conditions. The patient is actually awake. I had his consent before I took a picture of it. The patient is awake. You do not need to be anesthetized during the procedure. We just clean this part of the hand and then we put the catheter in. This is another way of putting in. It's usually not painful. Okay, so before procedure, unless it is during a heart attack, usually all you need to do is to fast for a few hours and stop a diabetic medicine, take blood thinners, and make sure you drink enough water. The procedure itself, the angiogram procedure, takes about an hour. Usually, patients are awake, but if very, very anxious, I can always give light sedation. Local anesthetic is used. And generally, after the procedure, the catheter is removed and the sheath is removed. If it is done on the leg, then the patient has the femoral artery, then you have to lie flat for 6 hours and have a compression bandage overnight. The reason is the artery in the leg is super big. It is the size of your thumb, whereas the artery in your wrist is very small. It's only like 5 millimeter across. And after the procedure, if medications are given, please follow instructions and do not omit the medicine. Other questions that can be that I know will be asked is what type of stents are put in. What are stents? Stents are made of cobalt chromium or platinum chromium. They do not react with the body. They are completely inert and they're very thin. Usually it's 0.071. It's very, very inch in terms of diameter, and they are very flexible. And there are many types of stents, but we generally use drug-coated stents nowadays to make sure that the stents stay in there and remain open forever. And the chance of stents blocking up is less than 1%, but higher if you have kidney failure or diabetes. There are many, many stents available. All these stents are very good. In fact, the stenting procedure is so good nowadays that fewer patients need to go for bypass surgery. Bypass surgery involves, for patients who can't go for stenting, the reasons for going for bypass surgery is that there are just too many blockages that can be stented. Usually, we will take the internal mammary artery to make a bypass on the blocked artery, like a flyover, like a PIE flyover. If the blood cannot flow this way, then we put a bypass graft here. Or we can take a saphenous vein from the leg and do a bypass procedure onto the artery. So there are many ways to do bypass grafts, but it is an open heart surgery, and the recovery really depends on how fast the healing process is. It can take a few weeks and a few months for the bones to heal. I'm coming to the last part of the talk, which is about prevention of heart disease. If there's diabetes, HbA1c, or the sugar control has to be less than 7%. Generally, for blood pressure, the control has to be good. It has to be less than 130/80 for best blood pressure control. For cholesterol, we try to aim for as low as possible. LDL levels of less than 70 for the bad cholesterol, and HDL, which is the good cholesterol, of more than 35. Triglycerides have to be less than 200. Sometimes more than one medication is required to treat high cholesterol. And of course, lifestyle changes like weight reduction and smoking cessation depends on you. The last part also includes talking about dietary problems. Do not overeat. Basically, do not eat, do not ingest too much sugars, too much oil. All these are bad for the heart. These are bad for the heart. It doesn't mean that you have to abstain completely 100%, but I guess once in a while you can take a small portion of it. Don't make it a habit. I want to talk about this example of a 45-year-old female who has no medical problems before. She's very, very healthy. In fact, she was trying to train for a half marathon, and also at the same time she wants to lose weight, and started herself on a keto diet. Okay, on the left is a normal artery, blood flow. On the right is her artery. After she started herself on the keto diet, she developed chest pain, and the flow is really slow. You can compare on the right and on the left and right. So the normal blood flow is quite fast, but the flow through somebody who had who has microvascular problems is a very slow blood flow. Okay, I'm going to show you again. This is a normal filling of the coronary on the left, and this is her filling, which is very slow. It takes about 2 to 3 or 4 heartbeats before the blood flows to the end of the artery. You can count here: 1 heartbeat, 2 heartbeat, 3 heartbeat, 4 before it reaches the end. Whereas over here, you can see that the blood flow. Okay, let it load a bit. Is much faster. So within 1 heartbeat, it goes to the end of the vessel, whereas over here it takes 4 heartbeats. So this is a phenomenon of slow flow where even if your arteries are completely normal, like in this lady's, if your arteries are completely normal, you can still get a heart attack. So what happened to her is she suffered chest pain, she suffered a heart attack, a small heart attack. She ended up in hospital. I diagnosed slow flow for her, started her on cholesterol medications, and once she's home on cholesterol medications and on a normal diet, a year later she's back to training for her half marathons. Okay, so all's not lost. Everything can be still resolved if you recognize it early. Is this the blood flow? Very slow flow down to the artery. So dietary choices is super important, but it's all controlled by yourself. You control your diet. We can't do anything about the diet. Please make sure that you avoid overeating and don't smoke. Don't drink too much. Okay, and don't have too much salt in the diet. Have more fish. Fish is high in omega-3. It raises the good cholesterol. Have more fruits and vegetables because these have a lot of antioxidants, which are important for the heart. And the whole grain food are full of vitamin B and E and antioxidants, also very important. And last of all, I shall not understate the importance of healthy lifestyle and exercise. Early detection and prevention leads to a long, healthy life. And that brings me to the end of the talk. Thank you very much.
Well, thank you very much, Dr. Lim, for the very, very detailed and graphic presentation as well. I'm sure everybody enjoyed. A lot of people are actually watching, and this is really interesting. Okay, ladies and gentlemen, we have, of course, the highlight of today's presentation as well, or sharing. We have Ms. Amelia, a heart attack survivor and client of the Singapore Heart Foundation Heart Wellness Center. So I'd like to bring forth Amelia right now to share her amazing story, and we hope you guys will enjoy the presentation. Hello, Amelia. Can you please tell us about yourself, like your age, your passion, and how the silent heart attack got you? Tell us a bit more.
Hi, everybody. Good afternoon. My name is Amelia. I'm 47 years of age. I'm an avid exerciser. I love outdoor activities. As such, I took on triathlon, swimming, cycling, and running as a recreational sport, and I've been doing it since 2008. I experienced a heart attack symptom just last year when I was at the stadium.
What was the symptoms that you actually felt when just after you got it? What was it like?
I was actually exercising and I was doing my finisher exercise. So at my 100th squat, I began to feel tightness around my neck and numbness in both my hands. So I just waved it off, maybe in thinking that it's just due to fatigue. Then I started yawning. The yawning became very frequent. And then I got some slight dizziness. I started walking out to the stadium and the symptom progressed with me feeling nausea, and I started throwing up. It was then when I got back home that my parents were not comfortable in seeing me sitting up and lying down, that they began to call my sister. And it was my sister and my brother-in-law that made the call to call for an ambulance.
And what happened when the ambulance came and you went straight to the hospital? How were you feeling, and what procedures were they putting on you and all that?
I was trying to keep myself calm and relaxing my muscles. Um, they did a test, my blood pressure. They took my heart rate. And I remembered one of them asking me, the paramedics, showing me that my heart rate was pretty low. But my argument to that was that as a triathlete or a triathlon athlete, there's a tendency that your heart rate tend to be low when at resting.
Hmm. So that's a misconception that most athletes, like myself, I sort of thought that we were so fit, but actually, a silent heart attack can happen to just about any fit person, whether you're an instructor or a triathlete like yourself. So it is quite a very uncommon situation. That's why we're all here today. So, can you tell us a bit more about the lifestyle after the diagnosis? What was the preparation that you had before and after the operation? I'm sure.
I'm pretty much an early to bed person. I watch what I eat in proportion. I do not believe in restrictive eating or dieting. And I am not a sugary drink person. I'm pretty much okay with just plain water. And I love to exercise. I exercise 6 days a week, 1 day of recovery. And that's why it surprises me that it happened.
Okay, so now that it has happened to you, and I'm sure you're given a lot of advice and some help as well from the Singapore Heart Foundation. And what is your lifestyle right now? Is it almost similar to before the heart attack, or it's somewhat different?
I would say, not say pretty much. Pretty much. The only difference, I would say, the major difference is my physical activities. I had to change that because I had to move from highly intense workout to now moderate because I need not to injure my heart further, and I need to strengthen the muscles of my heart. So I had to change that, and that requires quite an adjustment.
All right. So we thank you for sharing with us. And of course, we're going to go back into the program with more questions and answers. And of course, hopefully, some of the questions may be directed to you as well. And of course, majority will be to Dr. Lim. And viewers, we only have about 10, at the most 15 minutes to answer all your questions. So once again, thank you so much. Let's thank Ms. Amelia for joining us and for sharing as well. So let's go back into the Q&A, which is very, very important. Hopefully, our two guests here will be able to answer for you. Okay, so let's begin with I would say more of an outstanding question. Tell us a bit more about maybe to Dr. Lim. Tell us a bit more about this silent heart attack. What is it to look out for silent heart attack? Any early symptoms about silent heart attack?
All right. So yeah, uh, the silent heart attack means that a heart attack has already happened and nobody knew that the patient doesn't know that he had a heart attack. So that's a silent heart attack. Sometimes I see it in patients who come in for breathlessness, for swelling in the legs, but the heart is already very weak because of multiple previous heart attacks. That's a silent heart attack. So how do you tell that um, you had a heart attack before? If such things happen, I really think that it's got to do with early screening. Do visit your friendly GP. The GP actually has a role, a very important role in taking care of uh, early detection of high blood pressure, diabetes, and cholesterol, and then looking at family history. Yeah. I have a question for Amelia. I must say thank you very much, Amelia, for sharing your experience with us. I am a little surprised you got a heart attack at the young age of 45, and you have an active lifestyle as well. Maybe you can tell us why or what are the risk factors that you had?
Actually, at the age of 41, I do have a regular checkup way before then, but I stopped at the age of 41 because I was flagged by my GP he actually told me that my cholesterol was, the good and the bad was on the high side. And he wanted me to start on medication. But being an athlete, it's a no-no. So I was reluctant on taking on the medication, and I wanted a retest to my cholesterol. But what happens then, I did not follow up with the retest because I was in thinking that I could actually manage the cholesterol as I was getting fitter, I was getting stronger, and I was all well.
Okay, so I'd like to highlight this very important point that Amelia has said. At 41 years old, if let's say a doctor tells you that you have high cholesterol, it is not necessarily wrong not to take medications. Uh, you know, it is okay. So what do we normally do when we check cholesterol? Because a lot of you would be going for health screening on a yearly basis. If the cholesterol levels are high, we want to look at the trend. We want to see what happens if you change your lifestyle. So if it still remains very high, then we'll look for other risk factors. I'm not exactly sure, Amelia, whether there were other risks involved, like family history, like
Oh,
was
yeah.
there?
Yeah,
Yeah.
both my granddads, my paternal as well as maternal granddads, passed on due to heart attack.
Okay. So one thing to note about family history is generally we don't look at grandparents that as a very strong link. We look at parents because that is generation once removed for the grandparents. So I'm still a bit surprised you got a heart attack. So at 41, what I would have done if it were a patient I'm seeing is I would have tried to um, advise for diet control, exercise, and see whether the cholesterol comes down. Then I will do a scoring system. We actually have a scoring system for predicting heart attacks. It's not foolproof, but it gives a 10-year risk of prediction. So looking at the profile, like for example, blood pressure profile, sugar, um, whether there is menopause or not, whether menopause and male sex are risk factors, um, smoking history and all these things. If everything is negative, it's still very rare to get a heart attack. So for you, it might be very rare to get a heart attack. So the message to everyone is now we're seeing more of that because of increased stress levels at work. I see a lot in people who don't sleep well at night because of job stress or because of too much traveling. But of course, now during COVID, there's no traveling. So those that work across time zone is a problem. And also patients who have sleep apnea. So first of all, there's the problem of obesity causing snoring issues, but that undiagnosed sleep apnea means when you sleep at night, you stop breathing for repeated numbers of times to cause the oxygen levels to drop. So that alone is a risk for getting heart attacks. So these are all the unknown risks that people have that they don't know about. So when we talk about silent heart attacks, a lot of times they have a lot of these risk factors, just that nobody actually looked at it. And then I've also treated patients who claimed that they had no chest pain, but they came to me because they have failed their treadmill test. They claim they have no chest pain. They failed their treadmill test. I had to put a couple of stents in for them. And then after that, they come back and said, wow, I feel different now. I feel lighter. I feel more energetic. Like there's this guy, 55 years old, who does IT job. He says, wow, now I can climb, I can go to the bottom of the cupboard and fix the wires with no problem. Previously I couldn't do. I just asked the younger people to do. So it is not exactly silent. Sometimes they just don't know what they're feeling. Yeah. So thank you, Amelia, again. A lot of things you highlighted are very important for us. Yeah.
Thank you, Dr. Lim.
Okay, one more question for Dr. Lim. Now, you mentioned about one of the patients, or rather one of the cases where you mentioned that the person was on a keto diet and had a slow blood flow. Now, I'm sure this is a very sensitive question, also a very commercial, sensitive question as well. What causes this to slow down the heart? Was it the keto diet itself, or was it her existing diet that makes her blood flow very slow?
Okay, Samson, this is a very, very important question. It is not a sensitive question at all. Okay, it's very, very important. Keto diet is not safe. Okay, keto diet, if you do it correctly, according to the keto books, right, you're supposed to eat only fat, animal fat, and meat, protein, and abstain from eating any form of um, carbohydrates or fruits and vegetables that contain carbohydrates, like even apples, grapes, all these cannot be eaten. So when a person is on a keto diet, they actually have to check their urine for ketones, which is by no means cheap either. It's quite expensive to buy the dipstick to check that they actually have ketones in the urine. So if you're on pure keto diet, the blood cholesterol goes sky high, okay, without you checking on the blood sugar. I mean, blood cholesterol goes sky high, and because of that, it clogs up the microvessel. It doesn't immediately cause atherosclerotic plaques in the arteries. It actually clogs up all the microvessels. So because the outflow, when you try to inject something into the artery, there's no outflow, cannot come out. So that's why the flow is so slow. We call it slow flow. Slow flow is microvascular disease. Slow flow is not just seen in keto diet. Slow flow can be commonly seen in patients with uncontrolled diabetes, can be commonly seen in end-stage renal failure, can also be seen in females in the postmenopausal and high cholesterol condition. So this keto diet question is important because number one, it highlights that keto diet is not safe for the heart. It can cause heart attacks. Okay, of course you can lose weight with it, and you may be lucky without getting a heart attack, but it's not safe to be on a keto diet. That's the first. That's the first conclusion. The second conclusion is keto diet. At the example I gave you, keto diet is the same as developing very, very high cholesterol levels, um, uh, not genetically produced, but caused by yourself. So it's self-generated, very high cholesterol levels, and it causes slow flow. So that brings me to something else that I want to elaborate on. As you know, next week is International Women's Week. And well, initially I thought they asked me to talk because of that, but but no, it's just a heart attack symposium. But next week is International Women's Week, so half the audience here, I presume, are females. Whether they're listening for themselves or listening for their family. Usually, females come and listen to tell their family. I would like to have a message for you: is that post-menopause, between the age of 50 and 70 years old, your cholesterol levels double. Okay, you do not know, but if it's high before menopause, it will be even higher after menopause. So at some point, you have to start cholesterol medicine. So the cholesterol level can double for females between the age of 50 and 70. A lot of times, they will start getting symptoms of around 50 years old, they get symptoms of palpitations, palpitations, breathlessness, but no chest pain, just palpitations and breathless. And if we check the artery, the ECG is normal, the echo is normal, the CT scan is normal. But what's abnormal is we don't do angiogram, right? If you do an angiogram, they will have slow flow. Okay, so when you, unfortunately, it is commonly missed because a lot of times the doctors in the clinic, the cardiologists, I would say, would generally say, oh, your CT scan is normal as well. You don't have blocked arteries, but how about, why do you get a palpitation? So palpitations in postmenopausal female may be due to microvascular disease. So just take the cholesterol medicine if it's advised, because your cholesterol will be going out anyway. Thanks.
Thank you
We
very
should take the
much.
next question.
Okay, thank you very much. Now, the next question is going on to Amelia. Now, Amelia, I understand that you went to Singapore Heart Foundation and you had some help as well from the dietitian and also the physiotherapist. So, how did it help you after the attack? What was the changes that you had? What did they tell you, to do, and how did it improve your lifestyle after that?
Sorry again. I'm sorry because I
Yeah.
was trying to unmute. Yeah. Oh.
Yeah, so the question was, how did the physiotherapist and dietitian at the Singapore Heart Foundation help you in your post heart attack recovery? What did they do? What did they tell you to eat and not to eat?
Well, they helped me to regain back my confidence. That's very important. And after which I I worked on also my fitness, and I had a very productive session with the dietitian. She has advised me actually to increase my intake of fiber, and have given me ways on how I could do that. And since then, that also have rubbed on the confidence and the trust of my family members, especially my mom and dad. So that helps a lot, because now they are more confident if I said that I want to do a workout, rather than them being, very worrying about me and being protective of me.
Mm, thank you so much. Now back to Dr. Lim as well. A question here from Humaira. Now, what causes a healthy person who does not smoke and drink but still can get a heart attack? Dr.
Um,
Lim? Mm.
okay. So a lot of people ask this question, especially those that actually suffer a heart attack and they are previously healthy. We also try to find out the reason. It could be so that there are a long list of risk factors. Even if you can't find any reason, it still could be genetic. So sometimes it's just a little bit difficult to predict. Yeah. High stress itself can cause a heart attack, just high stress. And the artery can be normal. So there's this condition of the artery called dissection, coronary dissection, where during the severe high stress, the wall of the artery, there are three layers in the artery, it splits. So when the wall splits, the lumen of the artery gets blocked. So that can cause a heart attack. So all sorts of things can happen. Yeah.
Mm. Next question from Sun Tiong to you. Why some people said that they do some balloon, but there's no stent in it as well, just balloon but with no stent. But in your presentation, you encourage having a balloon and a stent inserted as well. So is there any difference between a balloon and no stent inside?
Okay, so this is a technical question regarding what needs to be done to a blockage. And the technical question, well, I guess I really have to look at the artery to answer that question fairly. You need to look at the size of the artery, the length of the blockage, whether it's a big artery, a small artery, a branch, you know, yeah. So let's say if the blocked artery that has been ballooned is in a small branch and the artery is very small, we cannot squeeze in a stent, then we don't put a stent. Let's say if I can think of some other scenarios where a stent is not needed. If there's no blockage, then there's no need for a stent. But I'm not saying that if you had a balloon, there's no blockage.
Very good, very good. So there you go. We hope that answers the question as well. Okay, one more question for you before we go to Amelia. Now, a lot of people also ask this question. I see it keep coming back and back again. Now, a very tricky question. Does sleeping on the left side affect or aggravate heart diseases? Or is there a better way to sleep? Should they sleep on the left or on the right side?
No. There's no connection. You can sleep any direction you want.
Okay, there you go. So a lot of people were asking that question, which is the best position to sleep? Is it on the left or on the right? Okay, and the next question for Amelia, very quickly. Now, Amelia, lifestyle after your diagnosis, do you now exercise a little bit more? As you mentioned, you don't do some extreme exercises, but you still exercise a little bit after that?
I do. Because it's also about body reconditioning. So I'm used to having quite an active lifestyle. So the only thing that I do is in the reduction of the intensity of what I do. If I do in the past clocked in about 10 kilometers of run a day, then I'll do it half of that. Yeah.
Mm.
So everything that I do now is actually very heart oriented. So I've been given by the physiotherapists at the Singapore Heart Foundation to work within a recommended heart rate.
Mm. And what about your diet? what difference in your diet right now after all the help?
Oh, I've started increasing it. So before every meal, I make sure that I will have a some intake of fiber on
Hmm.
before my meal. So it could be a fruit, it could be a bowl of salad, or it could be even a fiber drink before I go on to having a meal.
Wow, what a big change. Question to anyone. Now, when someone suffers a heart attack, what is the first thing that we can do other than calling for 995, maybe as a bystander? What can we do?
Oh, okay. I'd like to take that question. So, if someone suspects that they're getting a heart attack, you should really just immediately call for help. Okay, call for help first before you do anything else, or at least ask someone to call for help. Okay, the next thing is don't exert yourself too much. Um, Sometimes the heartbeat may slow down a bit, so coughing helps. Let's say if you feel faint, you can cough because the cough reflex increases the heart rate. We have often done that for patients. That means we monitor the heart rate is very, very slow. We ask the patient to cough vigorously a few times. Okay, if the heart rate is slow. Nowadays, it's very, very trendy to wear one of those fitness watches like Apple Watch, Garmin, Fitbit. You can actually see your heart rate. If it's slower than normal, I mean, let's say if you're still alert enough to look at the watch, you can give a few cough, and then there's this question about aspirin, whether it will help. Of course, it will help. So you can never be sure what exactly is happening. Let's say there's a instead of getting a heart attack, you're actually getting a bleed in the stomach. Okay, nobody knows, what will happen if you take aspirin. It actually doesn't help. But for heart attack, we give when you reach the A&E or when you reach the ambulance, we generally give 3 aspirins straight away, and we load with 6 tablets or 8 tablets of Plavix, which is clopidogrel. So we give a whole bunch of blood thinners upfront to a patient with heart attack. If you don't give it to yourself at home, most people don't have aspirin at home anyway. But if you do have, just pop in a few. Yeah, it can't be helped if, let's say, it's not a heart attack and then you took the aspirin. But if you have it, it might be useful.
Hmm. Okay, so ladies and gentlemen, we almost come to the end of the show, but of course, we'd like to hear a little bit more from Miss Amelia and Dr. Lim as well. We'll start with Miss Amelia first. Miss Amelia, what are the closing, what sort of advice that you like to give to those of them who are exercising and thinking that they're healthy and a heart attack won't occur to them? What would be your advice to all of us?
Well, being fit, being strong, even being slim, or even being well is not a direct indication of our health. And what I've learned through this experience of a heart attack is going for health screening is not just important, it's a must, because being ignorant of your heart or your health condition is actually not a peace. There is definitely consequences to that.
Hmm. Very good. Thank you very much, Miss Amelia. And Dr. Lim, any final advice to all our viewers right here?
Yes, yes, of course. I see that there were quite a few questions about health screening. Um, so, number one is get diagnosed early. Okay, diagnose doesn't mean you must diagnose with an actual heart problem. Diagnose means look for the risk factors. So I must repeat, look for risk factors. That's why going to health screening at a GP clinic is the first step. Look for high blood pressure, diabetes, and cholesterol. Look for family history. Don't smoke, etc. Then regarding diagnosis, the GP or the health screening doctor will decide to send you to a cardiologist for treadmill test. That's the first step because that's the cheapest test. That's non-invasive, no injection, no X-ray. If you fail it, then we just have to go and do other tests. But of course, there are some patients who actually already have symptoms. If they have symptoms, then we go to a CT scan, for example, instead of doing a treadmill test. However, if cost is an issue, we still fall back on the treadmill. So early screening, uh, take your health into your own hands and trust your doctor. If the doctor advises something, even if you don't do it, don't stop seeing. Just go back again because sometimes there may be new things that you need to know about. trust your doctor. And once again, I would really like to thank Amelia for standing out, for agreeing to actually share your experience, because I think it just makes the talk more relevant to people. And thank you so much. And thank you to Samson, and thank you to Heart Foundation.
Thank you. Thank you, Dr. Lim. Thank you, Ms. Amelia. And thank you, everyone. I know we have so many questions that were unanswered, but of course, the organizer will update you. And we hope to also let you know about more about the recording. Some of you were asking whether you can review the recording and the slides as well. We'll update you and we'll let you know. In the meantime, we have some important information for you. Now, with support from AstraZeneca, SHF has also organized a social media contest for a chance to win up to $50 NTUC Fair Price voucher and also an SHF goodie bag. Now you can follow the link provided in the chat box. So let's get the organizer to put that link inside as well. And for more information on heart health, you can also visit our website at myheart.org.sg or Facebook page at facebook.com/heart foundation. Okay, so go to our Facebook page and you can find out more information, maybe post some questions as well. And we try our best to answer your questions at the same time, give you more information about the videos and slides as well. Okay, so from all of us right here, we'd like to say thank you very much for joining us. And we hope you have a wonderful weekend ahead and a great heart health. Thank you, Dr. Lim. Thank you, Ms. Amelia. And this is Samson Z. Bye bye, everyone. Take care and God bless you.